The opioid epidemic has been around for years, but because of the recent uptick in overdoses and deaths, it has now taken center stage nationwide, especially here in South Florida.
This is a problem that affects everybody, not just the homeless population or the people living on the street, but doctors, lawyers, housewives. It affects everybody. Everybody has a friend or a family member that has been affected by this. Here at this hospital, we probably see at least 1 or 2 patients every day that are either using or overdosed on opiates.
Liz Fisher is a mom in Pembroke Pines dealing with opioid addiction.
My husband and I have 4 beautiful kids. They're now adult children, and grew up in Pembroke Pines, and our 3rd son is struggling with opioid addiction. I have to say, Michael was a great kid. He was a 3rd boy. Got used, just was that tag-along kid, went to everything, was really easygoing, no issues in school, ever, never had a call from the school with any issues, any problems. I think we really didn't know. We didn't know anything. We only started getting suspicious that something was going on when he was probably about 21. He just was not able to pay his bills, and there were things that were starting to unravel that just didn't make sense. If you just find out your loved one struggling with addiction, and especially opioid or heroin addiction, by the time you have found out, it's pretty bad.
It just became such an important issue to me as I started researching it, to really see how it devastates our families and then how it devastates our communities, because it destroys our families.
This inspired Commissioner Seipel to introduce a resolution to the Pembroke Pines City Commission that included adopting the Prescription Drug Monitoring Program.
The resolution actually was supporting the U.S. Attorney General's request for a national database, a national prescription database. And what that would do is that it would end sort of this doctor shopping that people have done, where they can go to 3, 4, 5, 10 doctors and get prescriptions.
So in a perfect world, the Prescription Drug Monitoring Program should be made mandatory. And there are many things that have been put in the legislative at the state levels and at the local levels to say we should make this mandatory, but it hasn't taken effect yet.
Cities across the country, just like here in South Florida, are struggling to find the right solutions to this epidemic, and everyone has ideas.
Have a community town hall, just educating families about what it looks like, what to look for, what you can do to try and prevent it, and what kind of conversations to have. A lot of people just don't know they don't know. They don't even know where to even begin. So even just a list of phone numbers to call for treatment, for therapists, even for the family members to get help for themselves.
Cities like Pembroke Pines, we have armed our police officers and our emergency people with a unit, so if somebody is overdosed, they can quickly give them a unit, save their life, bring them back, and hopefully then say, we have to stop this addiction. We know how to do it. We're going to help you. We have to educate our people and our residents to let them know, here's what the signs are. Here's what you have to look for in kids or adults. And that's our job.
So one of the things that has been done already is tracking the data. So we need to know the magnitude of the problem. And we now know by tracking the data through the medical examiner, through some of our data at the hospital level, how big the problem is. Putting the resources together and trying to coordinate care between the hospital and the community and the behavioral health network that's in place. I think that's the biggest challenge, and that's where we're sort of looking at right now as a healthcare entity, to coordinate care between the hospital and behavioral health out in the community and the EMS agencies that pick these patients up, and trying to work together to address the issue.
I would say that it takes a community to combat this epidemic. What we have facing us is probably unprecedented, and we have to come together. Not only is it the funds, but it's the different individuals, different professionals that are needed to combat this opioid epidemic at hand in Broward County.
By coming together as a community, there is a light at the end of the tunnel. There is a glimmer of hope in fighting this epidemic and helping those that are affected.
I think the worst part about the opiate addiction is that most of these people, if they had a choice and they had the resources, would rather get off of these drugs. But unfortunately, as a society, and it's not just unique to South Florida, but as a country, we haven't put a lot of that infrastructure in place to help these people get off of these drugs. But the saddest part is that most of these people, when they're sober, when you have a conversation with them, would really rather be off of these drugs, but because of the physical, emotional, and psychological addiction, it's very difficult for these people to get clean.
I think, and I truly believe, as I tell people, my son has been, probably 25 treatment centers in the last 4.5, 5 years. And he keeps trying, he keeps trying, he keeps trying. And the goal we want for our loved ones is to get back what they lost. That, to me, is recovery. Getting back what you lost. And that means to me being a happy, independent, productive member of society, living their life.